I recently received an email from a mother who was very concerned about her teenage daughter who was having symptoms of RSI. Dear Deborah, I'm writing on behalf of my daughter who is a senior in high school. Starting junior year, she started to experience wrist discomfort. After an intense junior project of editing a documentary, on top of being a prolific writer, calligrapher, photographer, she has since had significant pains in her wrists and forearms that have not gone away. She has had periods over the summer when she was better, but easily re-triggered. She has an ergonomic workspace, including voice dictation, and she has been to see several physical therapists, including a hand therapist. We would value advice on accommodations for school and just how to know what is okay to do and what isn't. Can you recommend doctors? I just feel helpless in supporting her. Thank you, concerned mom. Dear concerned mom, I really feel for you. And there's a lot here that we need to unpack. So let's take it step by step. Like many teenagers, your daughter is exploring a lot of different interests, and all of the things she likes, writing, film editing, calligraphy, and photography, require intensive hand use. You didn't mention whether she was playing video games, but that is a common activity among teenagers and can be highly injurious. All of those activities are also highly engrossing, and because people very often forget to take breaks and work for many hours on end, this is a risk factor for repetitive strain injury because the tissues need time to rest or they can become strained and injured. You mentioned that things seemed to be getting better over the summer, but then she kept getting re-injured. This is a very common problem among people with repetitive strain injury. Just because you're out of pain or feel better momentarily when you're not actively using the computer or doing the offending activity does not mean that the injury is gone. The tissue that is healed is more fragile than the normal tissue, so it's more easily re-injured. And then you get into this vicious cycle of injury and re-injury. That's why it's so important to take breaks and not overdo it. The tricky part is knowing what your limits are for any given day and not going beyond them. If you try to go back to the number of hours that you used to work before you were injured, you will likely re-injure, and the re-injury can be worse than the original injury. You said your daughter had an ergonomic workstation. As I have said many times before, it's somewhat helpful in preventing repetitive strain injury if it's done properly. But ergonomics will not cure RSI, and it won't even necessarily prevent RSI because there are too many other factors. Furthermore, the advice that you will get if you go online to see how to set up your workstation is incorrect and can actually lead to or worsen an injury. That said, even a state-of-the-art workstation won't help you completely prevent repetitive strain injury because it doesn't take into account the sheer number of hours that you are sitting in front of a computer using your hands at the keyboard and mouse. I recommend you follow the guidelines in my book, or I have a brief description of them in an episode on my channel. You didn't mention whether your daughter used a laptop or a desktop computer, but that can also make a big difference. Laptops are inherently risky because if the neck is in good position, the hands won't be. And if the hands are in good position, the neck won't be. There needs to be a separate keyboard and keyboard surface, and the laptop monitor needs to be raised to an appropriate viewing position where the head is in good posture. Not only that, seating and other angles need to be correct. If I were doing a workstation evaluation of your daughter, I would look at her posture and how she is using her hands when she is using the keyboard and the mouse. This is really important. If she has habits such as forward head posture or improper keying technique, that could explain a lot of the injury and also how to get out of the injury, because I could teach her how to use her hands in a more neutral position. But people need to be seen one-on-one in order for this training to happen. Once the improper technique is identified, I can show her how to use her hands in a more neutral position. But if you have voice dictation, that's really the way to go, and use the keyboard as little as possible. And when you're using the keyboard, use good technique, a light touch, and avoid the mouse completely if possible. There's also an excellent video on my channel about the dangers of typing, and I highly recommend that you view that. Regarding finding a physician, there are very few doctors who truly understand the complexity of repetitive strain injury. There are many reasons for this. Medical students are only given a few hours learning the upper extremity in medical school, and even though repetitive strain injury is one of the leading occupational injuries worldwide, few doctors are truly knowledgeable in this area. One way to find a doctor who may know something about repetitive strain injury is to look for a physician who specializes in occupational medicine. Osteopathic physicians can also be very helpful. Finding a doctor can be frustrating and time-consuming, but if a doctor immediately dismisses her symptoms as aches and pains or reaches for a prescription pad without really doing a thorough examination, that's not a good sign, and I would keep looking. A good examination can take an hour to an hour and a half, and it requires a fair amount of follow-up to make sure that everything's progressing the way it should be. And many doctors just simply don't have that much time to devote to a patient because of the way they are reimbursed by insurance companies. The doctors who do take the time to understand repetitive strain injury and take an interest in people with repetitive strain injury are worth their weight in gold. So if you do find someone wonderful, please let me know, because I would like that person's name so I can refer them to the many people who are asking me for a good referral. And while many doctors may not be expert with repetitive strain injury, there are lots of really great physical therapists who do have a good understanding of repetitive strain injury, although they can't diagnose you. Still, not every physical therapist will be equally well trained. So you may have to keep looking. See the video on how to find a physical therapist on my channel. And remember, even though people might feel better during or briefly after the session, that doesn't mean that they can go back to their old workstation or old work habits or the amount of time they used to spend at the keyboard. Not all physical therapy is created equal. In some clinics, the physical therapists are expected to see 3 or 4 people an hour. So what happens is they will see the patient, put on an ice pack on the shoulder or the wrist or the forearm, and then walk away and come back 20 minutes and take the ice pack off. And that was your session. And in general, this is not really going to get you out of the woods. People with repetitive strain injury need careful guidance. They need one-on-one manual therapy, preferably with the same therapist, and that same therapist will be showing them remedial exercises that they need to do on their own. This is really important. There are some physical therapy clinics who still will give patients 45 minutes or an hour, and if you can find one of those, that's generally a really good sign, because they are really devoted to getting the patient better. It's also really important to trust your instincts when it comes to people in the helping profession, such as doctors and physical therapists, and some complementary professionals, such as acupuncturists or other people that you might see. Are they helping you? Are you getting better? Do they take the time to listen to your concerns if you have concerns? If, for instance, you found that their pressure was too deep, did they respond and back off when you told them that? Did you feel comfortable telling them that? These are all ways that you can work well with your physical therapist. And remember, even if physical therapy is really helping you, you can't go back to the way you did things before or the amount of time that you used to work at the computer before. You will need to be extremely careful in how you use your hands for every activity, not just at the keyboard, but also holding your phone, writing with a pen, all the things that you do, pressing elevator buttons, all the things that you do on a daily basis will now need to be revisited, and you need to look at them and say, is this hurting my hands? How can I do it differently so I'm saving hand strain? Speaking of holding a pen, I did a short video on variations on how to do that that are very helpful for people who have pain when they're writing. So I recommend that you look at the playlist that I did on ergonomics and really familiarize yourself with the concepts there. There are also episodes on how to find a doctor and what doctors need to know about RSI. There's an episode on finding a good physical therapist and which therapies can be effective for people with RSI. And there are helpful videos on how to exercise with repetitive strain injury and general tips on coping. The best news about this situation is that your daughter can be her own best friend and really help her healing come along. And the way she does that is by getting in with a good physical therapy, learning and maintaining good posture, maintaining good pacing, good technique, doing her exercise program, the appropriate exercise program for the right muscles in the right way. And the best news is all of this will be up to her. She's in charge. So in many ways, her good progress will be something she can thank herself for. No one will care more about her hands or her progress than she will. And it's going to be really great when she realizes how important all these things are and sees herself getting better. That's going to encourage her to keep going with this program. Now, regarding accommodations, it may be necessary, and I would really recommend she get a doctor's note about what she needs. She may need more time with certain assignments. She may need certain accommodations in the classroom. I don't know, I haven't seen your daughter, but it's really worth it to get a doctor's note because that way her teacher will understand that this is a really serious thing and that your daughter needs this in order to keep doing well as a student. The other thing I'd like to mention is that it may be difficult for your daughter to explain to her classmates how injured she is because she doesn't look injured. She looks perfectly normal. This is a hidden injury that is not obvious to people that you would see just meeting them, and they may not be able to understand why she doesn't want to engage in certain sports or activities or why she doesn't use a computer the way other people do. So she will need to be strong and really not let other people push her hands because that could push her right back into re-injury, and nobody wants to go there. So thank you so much for writing and bringing this really important topic up for the community to see. People need to know about repetitive strain injury. You can't prevent a disease you've never heard of. And so what I recommend is that you go to my channel, and if people have questions, you can point out the episode that I did called The Stages of Repetitive Strain Injury. There's good information there. You can look at the warning signs of injury, and those are helpful videos to explain to other people what's going on. There's also a video about how to talk to other people about your repetitive strain injury that she might find useful. So again, thanks for writing in, and best of luck to you and your daughter. Click the subscribe button and hit the notification bell so you'll know when new videos are posted.